Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, you have a great Memorial Day weekend, but first we're going to take a look at nurse practitioners, what is their role, and then we're going to head to a very important topic, and that is getting work for people with disabilities. All of that follows these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
All right, we have a very important topic, employment for folks with disabilities. It's not just the question of returning military, veterans and the difficulties they're having finding employment if they have disabilities, but it's an important generic problem that we want to address on this program. Joining me, sitting next to me, is David Patti. He's the president and CEO of the Pennsylvania Business Council and a regular participant. Thanks, as always, for David. And we have State Senator Bob Mensch. He's a Republican. He represents a district that comprises Montgomery County, Berks, and what's that other county?
Bucks County.
Bucks. I better get that in. I don't want you to get any trouble back with your constituents. Well, Senator, thanks for coming in. And Lewis Hall, he's the digital community manager. And this program is called IWantToWork, right?
Yes, it is.
Explain it.
I will. The IWantToWork campaign is primarily a social media-based movement, and our goal is to change policies for people with disabilities through legislation. We're currently working on Senate Bill 1199, and we just finished up and got it signed, House Bill 400.
Right. That's all right. Relax. Everything's good. Everything's good. You all right?
Yeah, I'm good. Sorry.
No, you're fine.
Our main goal is to find competitive integrated employment for people with disabilities. Now, what that means, it's a fancy word, I know. Basically, to find people with disabilities working alongside non-disabled employees.
Sure. Now, you earned a degree at Penn State,
I did.
Didn't you?
I did, in finance and accounting.
Wow.
In 2013.
And so you're working on this campaign now. How broadly based is this campaign so far?
This campaign can reach anywhere from, 16, right out of high school, working while you're still in high school, to anywhere from 65, so retirement age.
Okay.
So we're reaching everybody.
And we're talking about employment in a whole variety of fields, right?
Yes. The only barrier that we're trying to do is competitive employment, which means not a sheltered workshop, not a place where it's only people with disabilities work. We want somebody to work right alongside you, me, the senator here, Dave Patti.
Maybe you run for office, but not in your not in your district, Senator. Go ahead, finish your thought.
No, that's all I have for this one.
Okay, Senator, talk a little bit about how important is legislation to accomplish. Well, first of all, what are the objectives of the legislation?
Well, to mirror what Lewis just talked about. The governor recently, and we're pleased that he did, the governor did an executive order mirroring what the legislation does. But executive order never connects all the dots and makes all the communications necessary. We're talking about the departments of Human Services, Education, and Labor and Industry, all needing to coordinate and begin to communicate better together. And we want to shift the funding. There is no additional cost to the state for this. It's all federal funding. And what we're doing is just changing the focus of where that money goes and how it is spent so that we can begin to provide additional employment opportunities, gainful employment opportunities for people with disabilities.
Now, is this primarily in the state? Would it be statewide? Would it be government?
Yes,
okay, so your expectation would be then that the state, and I don't know how many, what, David, maybe like something like 75,000 people work in the state now?
Right.
Used to be well over 110,000.
Yes,
I won't go there with you about that. But so where do you see the opportunities?
If you have the opportunity to visit a workshop, and I do, I've visited a number of them, I happen to have a son who is in a workshop. So I've seen this firsthand. And they do some very menial work for relatively low income. So many of these people want to provide for themselves, but because of the disability, very often they don't have the hiring chance.
Sure.
And yet we have opportunities in the state, jobs, good paying jobs that are going unclaimed. Mm. So we get these people aligned with a job that fits their skill set.
Absolutely.
And they can begin to provide for themselves. So I have a personal reason, but there's also the economic reason.
Right.
If we can't provide these people a sustaining wage, then the government pays for their services and their benefits. So if we get them into the economy, everyone benefits. The economy becomes more robust.
The other question I would have is, what do you think the possibility is? I'm going to ask David in a minute about in the private sector, but could counties do this? Could townships? Could boroughs?
Absolutely.
Is there anything going on?
Well, you know, we already have a number of federal laws. ADA, or Americans with Disability Act.
Oh, sure.
We have EEO, which was a broader umbrella back in the 70s that would cover something like this as well. And yet we don't seem to, in great quantity, be able to employ people with disabilities. So this is another effort to bring it back to the fore and try to increase that employment. But to your point, certainly the public sector has a great deal of opportunity. I see jobs in the Capitol every day that I think that people with disabilities could help us.
We're going to run to break. When we come back, David, I'm going to ask you about employment in the private sector, which is the area that you know best, and we'll come back to Lewis and sort of talk about where he thinks the focus could be. Well, this is an important topic, and we'll continue with this following these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, now celebrating 100 years as the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back to the program. Well, we've switched up our topics a bit. We're not talking about politics. We're talking about an important subject, getting work for people with disabilities. We're chatting with some folks who are directly involved, both at the core level, where folks with disability are actually trying to get the job, with a state senator who's been working on some legislation. And now I'm going to turn to Dave Patti. Dave, you're the man for the private sector. You understand this. Talk about, first of all, who's doing what now? Let's start with that.
Well, a lot of employers, and you know I've been coming in here many times telling you we can't find good employees.
Right.
So we should be looking at all possible employees. And you know, you certainly think of places like Giant Eagle out in Pittsburgh, Lowe's, Home Depot, who've really put an effort into hiring people with disabilities. But you know, we have to get beyond this kind of view of that there's a limit to what somebody with a disability can do. In fact, I don't know if it was Lewis, someone had told me a story, sad story, about a woman with a PhD who happened to be in a wheelchair. She was shopping in a Walmart, and somebody, of course, assumed she was the greeter. No, she was a professor who was shopping. And there are a lot of professional positions available to lawyers and professors and other people who happen to have a physical disability. But employers, I think, need to recognize, too, that when we talk about the soft skills, people who are going to show up on time, be there every day, within our disability community, the disabled community, we have great employees with that potential. In fact, the statistics show that hiring a disabled worker, they have fewer sick days and are more likely to be at work every day than, in fact, the non-disabled community. So it's great for the employer.
Senator, you feel the same way about the potential expansion, given the emphasis with, programs like IWantToWork?
Yes, I definitely do. And by the way, I think we had to plug the bill. It's Senate Bill 1199 for the viewers. When David was just talking, I had the thought, we call them disabled or workers with disability. They have a disability, but it doesn't mean that they're disabled in their work.
Yeah,
all right.
Great point.
And many of these people are intellectually or physically quite capable of doing the job, but they have something that we recognize as a disability, which limits them in other aspects of their lives. But very often they're very positive contributors to the job and to the economy.
And some of it, the accommodations that are necessary aren't even that complicated, right? I mean,
if I can interject
oh,
there.
absolutely.
The average cost of an accommodation for the average disabled employee is $250.
Yeah.
So, I mean, no business cannot afford $250, or you can't afford to hire that person in the beginning.
If you can't afford $250, you're just probably marginally staying in business
Absolutely.
anyway, right?
And also, one thing to add to what Patti said was, we also tend to stay at a company longer, and we're more loyal for that opportunity.
Yeah.
The average employee stays at a company about 7 years now is pretty much the turnaround rate.
Right.
We're upwards of about 10 or 11.
Right. Now, you were talking earlier when we had, on the break about moving people away from something called shelter workshops. First of all, for our viewers, what's a shelter workshop?
Okay, a shelter workshop is very simply somewhere where a whole bunch of people with disabilities work. They do menial tasks, anywhere from screwing on light bulbs, very simple tasks. And they'll be paid anywhere from $13 a week, and I said that, a week.
A week?
A week.
A week.
To $7 a week. And that just cannot be anymore.
And your point is they have skills and they're not using their skills. That's what go ahead.
Absolutely. The problem with a shelter workshop is everyone's lumped into one category. So even if, say I was in a shelter workshop, I'd be doing the same thing even with a college degree. It doesn't matter. The job needs done. You are a person, you are a body, and you will do the job regardless of your skills or talents.
Wow. And you find that in state government that it would not dramatically increase the cost, that there wouldn't be...
Not if they have the intellectual or the physical skills to meet the tasks that are required. And I think that plays throughout the entire sphere that we're trying to address here.
Yeah.
Home Depot and Lowe's, I mean, the same situation.
Right. And you're
these are people that can do the job.
Put the final word on this. You're optimistic that this is going to get done.
Yes, I am. Yes, because the governor governor's already done. Well, that's
I'm not allowed to. I'm trying to be neutral here.
We've had some very good success with legislation.
I can't be neutral.
Let me say this, Terry. The governor already did the executive order.
Yeah,
so
I know that.
This
right.
is an embellishment of what he's already done. So I see his cooperation, and it's a very bipartisan supported bill.
Wonderful. And how soon do you think?
Oh, I think this is something that people would love to do as part of the budget, as a good feel-good process.
Oh,
if they
you think it could be done as easily as part of the budget?
I mean, to get first moving, doesn't move.
Yeah, this is one of those bills that
you just said something that really makes it more likely to pass.
Yes, sir.
Didn't you?
Yeah, especially in this environment. Yeah,
yeah, that's right.
All right,
one more, you get the final word.
One thing that they missed was the goal is to have 7% of the state's workforce have a disability. Right. That is their goal. I don't know when the goal will be met, but that is the goal with the piece of legislation. That's what got me excited to work on this project, was 7% of the workforce. And you said, what, 300,000 workers are working for the state?
About 75,000.
75,000.
Full-time, but then the contractors.
So that's quite a bit of jobs that are going to be instantly created.
I just want to say, and of this 7% of the universe, only a third of them are even gainfully employed.
Wow.
So we have a great opportunity here, and we help ourselves when we do this.
Yeah. All right, we're going to thanks for coming in. Somebody has to come in and keep us updated on this, and we'll see where it goes. And I'm not neutral on this, and I don't care. It's something that I think is important to do. All right, nurse practitioners, what is their role? We're going to find out in a moment, and we'll see after we pay some bills.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out IWantToWork. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Healthsystem Association of Pennsylvania, working towards a healthy Pennsylvania, and by the Pennsylvania Coal Alliance, representing companies involved in America's most affordable, reliable energy source. To learn more, visit betterwithcoal.com.
All right, welcome back. Andy Carter, he's the president and CEO of the Hospital and Health System Association of Pennsylvania, joins me. We're going to talk about, I think, an important subject, that what is the role of nurse practitioners, how much, what is their practice, should it be expanded or not? As always, welcome, Mr. Carter.
Thanks,
otherwise
Terry.
known as Andy, right?
Great to be here. Thank you.
All right, look, let's start with this. First of all, what do nurses do now, the nurse practitioners, compared to what an expansion would look like in their duties?
That's a great question. What we want to do is make it possible for nurses to fully leverage all their training. These advanced practice nurses have extensive extra training and experience. And we want them to be able to leverage all that to care for patients and ultimately to expand access to basic health care services. You know, right now, these nurses have to operate under the supervision of a physician indefinitely. And we support legislation that was sponsored by Senator Vance, which, by the way, just passed the Senate Professional Licensure Committee by a nearly unanimous vote that would
Bipartisan.
Bipartisan.
You always have to mention that when we're talking in this state, right?
This enjoys tremendous support. And what it would do is remove this obstacle, namely having to have this collaborative agreement with the physician, which is essentially paperwork, and allow them after 3 years and 3,600 hours under a physician's supervision to be able to operate completely within their training and experience without that paperwork.
So tell me if I'm right or wrong about this. So one aspect about this would be that the nurse practitioner would perform a duty that would free the doctor then to do other things more consistent with their expertise and allow greater flexibility. Am I way off base?
No, you're exactly.
Expand on that.
You're exactly right on base, Terry. The trick is we have a shortage of physicians in Pennsylvania. We have 155 areas in Pennsylvania where we just don't have enough primary care services. And being able to free up physicians to concentrate on what they do best and using advanced practice nurses to really leverage their training and experience. Research in England shows that patients are often more satisfied by the care they receive from a nurse practitioner. And one reason is they're able to spend more time with a patient and they're able to explain processes more effectively than many physicians can. And that we are seeing a huge growth and demand from.
Well, one of the other elements to this is I keep getting different statistics. I thought we had the fourth oldest, not that it matters, fourth oldest population in the country. Now I keep reading where we're the sixth. It doesn't matter. We have an aging population,
we
right?
Do. 2.1 million Pennsylvanians
Which
are over 65.
Which means we're going to the doctors all the time.
They're going to the doctor more often. And when they get there, they have high expectations for having things explained to them. And if we can free up physicians to concentrate on their clinical expertise and use advanced practice nurses for the care needs.
And that's more critical in certain geographic areas of the state. I know that we read often about, and this is something you're an expert in, we read a lot about, well, you know, hospitals in urban areas, they have, you know, lots of the specialists that you need, but whoa, you get out, we have a huge rural population in this state, as we've been talking about. It's a big state geographically. All of a sudden, you're 60 miles away from, you see where I'm heading with this. Does this help assist that problem?
Absolutely. We have to expand the number of people that are providing primary health care in Pennsylvania. We are a huge rural community in Pennsylvania, and we just don't have enough physicians in these communities. It's true, though, that in many urban areas as well, we don't have enough primary care physicians. So again, expanding the supply of advanced practice nurses can help address that problem.
All right, we're going to run to a break. One of the other things, and we might as well take a look at the other side for a minute, in all fairness, and you have some ideas about, you know, what the opponents have said, and we'll get into that, and we'll cover some other subjects after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, advancing quality, improving lives. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Business Council and by the Pennsylvania Business Council Education Foundation.
All right, welcome back. Andy Carter, he heads the Hospital and Health System Association of Pennsylvania. He's a frequent guest with the guy we turn to very often about hospital and medical issues. All right, now there are some concerns about this on the other side. What have the critics said about this?
Well, opponents have said two main things. One is that it undermines this commitment to teamwork, to have these nurse practitioners being able to operate other than under supervision. The second concern is that it may impact quality of care. I have to look at the evidence. There's no evidence to support the notion that quality and patient satisfaction would change at all. In fact, there's research from the Office of Technology Assessment from Congress, there's research from the RAND Corporation doing work in Ohio, right, and there's research in England that shows quality of care would remain intact.
But hold on a minute, but why isn't there teamwork and cooperation? I mean, not to get personal, but I know people seen a physician assistant and then, well, the doctor has the information.
Teamwork.
I mean, what's this point?
Yeah, teamwork is held together by the commitment to working in concert on behalf of the patient. You don't need a piece of paper between the physician and the nurse practitioner.
Not only that, it's all online.
Well,
you can go and you can read the reports, and the doctor's reading the reports, and you can email them. In some ways, aren't we having more communication than ever?
And one of the reasons we want more nurse practitioners working with patients across the Commonwealth is that patients are more educated. Mm-hmm. It's going to take more time to work with them to make sure they're using those tools correctly. Yeah. Physicians have limited time to be able to do that. So we really want to strengthen the connection between patients and these advanced practice nurses.
Now, this also presents a challenge to everybody in the healthcare community. I would think for hospitals it means, well, now you have to set up new kind of internal systems and coordinating, right? Is that what's going on right now?
Huge effort through use of electronic medical records and systems to make sure that every part of the team, every person in the team knows what's happening to that patient. It's something that's a very high priority for HAP and for medical professionals across the state. We have to get information flowing more seamlessly so that when someone goes into the hospital, I as a primary care physician or I as an advanced practice nurse know that my patient just went into the hospital so that I can keep an eye on their care in the hospital.
And the consumer has more access to information, I think, because of the technology. I mean, I can get online right here and go to my hospital and get all the information I need, and therefore I'm able to raise a lot more questions and I think get better nursing and medical care in general, no?
And an educated patient is the best kind of patient. We encourage that kind of research.
All right, good point. Now you're going to come back and keep us up to date on this, correct?
Absolutely. It's really important legislation.
All right, thanks for coming in. All right, we'll see you next week for another edition of Pennsylvania Newsmakers. And as always, stay well.